Welcome to my world. We are on a knowledge journey into knowledge acquisition. Knowledge is power, health is wealth. Today's topic shall dwell on hypertension. Hypertension is a problem that requires almost a lifelong treatment of continuous drug taking. And of recent, there are certain breakthroughs that have made it possible for some people to be off the treatment drug forever. So this I shall expose to you as I title this topic, Hypertension Cure with Laboratory Assay. So let us sit down and enjoy as I move on to the slide section. But as usual, subscribe so that more quality production could come from me. More like will also encourage the production. Hypertension Cure Lab Assay. Outline, objective, case study, introduction, lab diagnosis, measurement of other hormones, conclusion. Objective, to expose the recent findings of hypertension cure in some people who have nodules in their adrenal gland and examine the possibility of using the same idea on some other hormones responsible for high blood pressure. Case study, 128 people participated in the study after doctors found that their hypertension was because of the steroid hormones aldosterone. It causes salt to retain in the body, driving up blood pressure. The scan found that in 2/3 of patients with elevated aldosterone secretion, this is coming from a benign harmless nodule in just one of the adrenal glands, which can then be safely removed. Introduction. In a research published in the Nature Medicine journal led by researchers at Queen's Mary University of London, they found that aldosterone-producing nodules that are very small and easily overlooked on a regular CT scan when surgically removed from 18 of the 24 patients achieved normal blood pressure of all medication for life. This is the picture of the kidney, and on top of it you see the adrenal gland from where the aldosterone is produced. From the above photo, adrenal nodules are found within the adrenal gland that sit above the kidneys, one on each side of the body. Adrenal nodules are not uncommon. By 70 years of age, up to 7% of people have a nodule in the adrenal gland. So that tells you that why you could expect hypertension at that age. Most of these nodules do not cause any harm and can be left alone. If the nodules is over 1 centimeter, blood work is recommended. To see if the nodules is making excess aldosterone hormones, 20% of nodules larger than 3 centimeter can show excess hormone production on repeat testing, and to stop the hypertension, they are surgically removed so that there is no more hypertension for that person. Lab diagnosis, the same picture you could see about 3 different hormones causing serious problems: the aldosterone, the renal, and the angiotensin. The combination of a CT scan for tiny nodules in the adrenal glands and urine steroid test of the hormonal assay will confirm the conditions of primary aldosteronism, PA, leading to sodium retention and hypertension. So the picture is very demonstrated. The renal is produced by the kidney and acts on the adrenal cortex. Other tests useful for diagnosis: histochemistry is useful for definitive histopathological diagnosis to detect precise the lesion responsible for PA, such as aldosterone-producing adenoma, diffuse hyperplasia, and micronucleus. The morning aldosterone level should be greater than 50 nanogram per minute with an aldosterone to renal ratio of greater than 30, and that is indicative of Cushing's syndrome. Measurement of other hormones: a morning serum cortisol greater than 5 grams per deciliter is diagnostic of Cushing's syndrome. That is another problem where you may have to remove the tumor producing this excess cortisol stress hormone. Morning aldosterone of 15 milligrams above, like indicative of Crohn's syndrome, as earlier mentioned. Angiotensin is also responsible for high blood pressure. So overproduction of renal substrate, angiotensinogen, could also be studied. In conclusion, globally, an estimated 26% of the world population has hypertension, and the prevalence is expected to increase to 29% by 2030. It is a major risk factor for stroke, myocardial infarction, vascular disease, and chronic kidney disease. It is very necessary to find more definitive cause of hypertension, like is found with primary aldosteronism, in order to reduce its morbidity and mortality worldwide. You can always watch more videos on health on my channel. Please stay hooked.